Our patients are from different cultures, and it's inevitable to get them. Next, we will explore the cultural issues and why it's important. And I will give a summary about my current research that I do in transgender patients and migrants on psychedelics and the challenges that we are having, then summarize and the recommendations for future research. So why do we do what we do? We are psychiatrists, I assume, most of us here, and we made a conscious choice of helping our patients with their mental health. And, today I stand here also as a clinician and also a researcher looking for answers for my patients. I will start the group. Showing the earth population, the village of 35 people, all the existing ratios remain the same. As you see, we live in an inevitable diverse population. Where does the culture fit in this picture? The shared learned behavior and meanings that are socially transferred in various activity settings for purposes of individual and collective action. This is a very dynamic definition we form, for example, here at culture, a culture of understanding each other. We have an image of a Dutch culture. Our policy has always been drug use and drug users. It was often the image of the Dutch from outside. Still, we have a drug we cannot stop people psychological and perceptual changes, as well as clinical safety. Researchers published guidelines to address this. Results from those times till now, we demonstrated that the efficacy of psilocybin, for example, for depression, addiction, OCD, LSD in the treatment of depression, anxiety, and substance use, and currently with the MAPS, we are talking about MDMA for treatment of PTSD. These promising findings are limited to small, predominantly limiting the of findings and excluding the people of color for potential outcomes. So how can we make generalization when we have a homogeneous group of people? That's the question. And when you look at we are talking about psychedelic privilege, which is the term addressing the psychedelics therapy. Privilege in the context of privilege to use secure place, indigenous facing high rates of imprisonment, land confiscation, and are denied the ability to use these traditional medicines themselves, which is stemming from their country, their culture. When you look closely of the MDMA research, which is now about to go to FDA for an approval, they are in their last stage, but you see many shortcomings in those research. One factor is low minority representation. It is maybe due to lack of cultural inclusivity. Maybe DSM has provided a more extensive discussion of cultural and previous editions, but cultural factors are just limited to CFI in the DSM. And also you see that there's a lack of understanding of trauma experienced by people of color. MAPS says that race-based trauma was not taken into account for the use of MDMA-assisted psychotherapy in the treatment of PTSD, and nearly all previous participants were white. And you see also the lack of ethnic diversity among the researchers in the psychedelics. There is a white dominancy, leaders of mainstream psychedelic medicine and the practice. Only by including researchers with specific expertise in the areas of cultural diversity and recruitment of the people of color, that might increase the minority participation, and we might begin to understand the effect of limiting minority participation. It seems like the people who need it the most cannot access it. And then the question comes, can this psychedelics therapy be relevant for people of color or other marginalized populations? So for that, with my group in the Netherlands, we are working in different projects. And one of the projects we started was psychedelics-assisted psychotherapy in transgender migrants. Why transgender? Because 1.4 million adults self-identify as trans in the US. And we realized that there is a great lack of research in that area. And then there is harm if you're not intervening it. Suicide rates are like 44%. And there's also a shame in the past of it's harrowing stories about LGBT in the mainstream psychotherapy. There was an effort to change their gender identity, but that's not what we are aiming for. We are aiming to help them to have the self-acceptation and reduce the shame. In our research, we have mixed methods. We are willing to look at the feasibility of MDMA-assisted psychotherapy with quantitative means and as qualitative psychological mechanisms, and we would like to have fMRI to look into neural mechanisms. Sorry. As a summary, the use of psychedelics is neither novel nor modern, but actually dates back to 100 years to practices of indigenous communities across the world. And while the history of psychedelics therapy is totally another chapter that can be touched, understanding its roots serves as important reference points. So 2017 FDA granted breakthrough therapy status for MDMA-assisted psychotherapy to treat PTSD, but can we really generalize it? And as study after study showed positive outcomes over the years, one thing was constant: there was little diversity among both the study participants and the leads. What can be our recommendations for the future? So, as psychedelics go mainstream, we should all consider how we can wield our privileges to make the ecosystem more equitable and accessible. We must question how we use power and privilege, not just because it's ethical to do so, but also because it advances the science. We must also realize that the difference between true collaboration versus tokenization. So avoiding this tokenization means going beyond simply inviting people from the other cultures, but really looking at the diverse voices that are sought with recognition of this as a necessity for the progression of science. And the last is cultural humility, to acknowledge that we are limited by our knowledge, or sometimes ignorant even of our own. And there's an urgent need to cultural humility in psychedelic science, prevent it from failing from the same limiting and often unethical traps that we have seen in the history. The last is, with my group, we were in the Parliament of Holland to change to advocate the change of the roles of psychedelics in our country, because as much as it might seem modern and pro, Holland has been unfortunately not as advanced as we would expect, like other European countries. So we had a talk with my group in the parliament, to the parliamenters, and they are about to hopefully pass a new policy for compassionate use for psychedelics. Thank you for your attention.